balance can be found through dedication and perseverance. I think that the metacognition, the self-monitoring and self-talk, or thinking about how I think, is very important with that. With fear, it's really just taking that one step at a time. And
Eric Fisher is a certified counselor based in Calgary, Alberta, with over 13 years of experience both in the US and Canada. Specializing in accelerated resolution therapy for trauma, Eric's private practice, Recovery Arts Counseling, serves individuals, couples, and families, both locally and remotely. He also works with the local clinics and holds black belts in American Kempo and Wadu Ryu. His first book, The Martial Art of Recovery, Self-Mastery Practices to Subdue Addiction and Achieve Mental Wellness, has been recently released. Eric, welcome to the show. So great to have you here.
Thanks for having me on, Brad. I appreciate it.
My absolute pleasure. If there was one message you'd like people to take away from this conversation, what might it be?
I would like people to take away from this conversation that there is more empowerment waiting for them than what they initially believe is there.
Thank you.
I'll keep it at that. You're welcome. Yeah.
I like that. That's pretty much what this podcast is all about. So really looking forward to unpacking what you do. So perhaps you could share a little bit about who you are, what you do, and where you've been.
Sure. Alrighty. I'll try to keep this somewhat concise. So my name is Eric, Canadian Certified Counselor. I'm originally from Tennessee in the States. I've been up here in Canada for almost 10 years, coming up in August. The government allows me to remember exactly when, just because of all the paperwork. It's nailed into the brain. And I did live in New Zealand for 15 months, Brad, like I mentioned earlier to you. Great experience. And so I've been in the field of mental health and addiction for probably 13 years as a mental health counselor. And I've done a lot of different roles: consultant, supervisor, mobile therapist, going to people's homes to do counseling in a community setting, clinics. I go out to retreats here outside of the city here in Calgary, Alberta, Canada as well. So that's me in a nutshell. I love biking, got a background in martial arts, and I love hiking. I like being out in the outdoors. I actually biked to work today, to the clinic, there and back. I don't do that all the time, but that was fun today. So that's me really quickly. Master's level clinician.
Excellent. Excellent. Where did your interests in helping people overcome or deal with trauma come from?
I would say that it's always been of interest to me because
this episode is brought to you by Start With Values. If you'd like to reduce stress and increase fulfillment in your work and life, then check out startwithvalues.com. There, you'll be able to download the Values app, which helps you to discover your core values and bring them to life through micro habits. There is a values course so that you can learn about the science and practice of core values, and you'll be able to pre-register for my forthcoming book called Start With Values. I hope that these tools will enable you to achieve more fulfillment and make more meaningful decisions on your journey of life. Now back to the episode.
I feel like we've all been through at least something that we could consider to be either traumatic or overwhelming. I mean, for me, personally, it was moving at a young age to another state, which doesn't seem like a major ordeal. However, I was almost 6 years old and it's all I ever knew. And I had a lot of feelings about that for a while with that move being uprooted. And so trauma for me has been of interest because I can see how someone can go through so much but also be empowered as well and come to that post-traumatic growth, and to be able to work with people and see that actually come about is mind-blowing. It's exceptional. It's hair-raising. It's just lovely to see. I mean, I don't want anyone to have to go through trauma, but for those that are actually able to, to persevere and to overcome and to come to a place where it does not live in their body as much, they're able to come to a place of growth from that. It's amazing to see.
And what about your interest in martial arts? Perhaps you could tell us a little bit more about which types of martial arts you're involved with and a little bit about that journey.
Yeah, so from 10 to 12 years old, I did Wado Ryu karate. I hope I'm saying it right. It's been a while. And I used to could do the splits back then, but I cannot do the splits now.
Okay.
That would probably send me to the emergency room.
Yep, same.
Yeah, yeah. You can relate, eh? And then from 16 to 18, I did what's called American Kempo, which is based on Grandmaster Ed Parker and his teachings. And he actually wrote a book called The Zen of Kempo, which has some really interesting sayings, quotes in that book. And so that's a lot about pressure point fighting. That's hitting different pressure points on the body for either minor, moderate, or severe damage to someone. So that's the two. And I see martial arts as a way of life. I don't actually practice in a dojo right now. However, it's just like mindfulness where it becomes a way of living, a way of seeing my surroundings.
Interesting. Perhaps you could tell us a little bit about the intersection between martial arts and addiction recovery and mental health. I mean, obviously, martial arts has played an important role in shaping your worldview, and it's a wonderful holistic methodology. How has this interacted with your addiction recovery and mental health services?
Sure. Yeah. So I like to look at it in terms of like self respect. And there's lots of that teaching when it comes to martial arts respect for people that I'm sparring with or learning with, training with, and also respect toward the self. There's also the concept of self control. So for me, what was difficult was getting to a place where I was between being passive with sparring and aggression. So when we're learning how to fight with sparring, I really had to be pushed. And so when it comes to even mental health and or addiction recovery, it's finding that assertiveness for myself. I'm not uber passive, but I'm not, super aggressive either with my approach with people in my life. There is such a thing as healthy aggression, which is an entirely, uh, it's a different concept entirely. However, when we look at this, those are some concepts. I could even give an example. So I did a book recently, and one of the techniques is called entangled wing. It comes from American Kempo. It's a defense against a figure four arm lock to like my right arm from the front. And so I translate that technique, entangled wing, to entangled values. And I know that from reading about yourself, Brad, that's a huge piece for you. And entangled values when it comes to martial arts, mental health treatment is, just a separation between integrity and recovery from addiction, and a lack of integrity when it comes to perhaps addiction is, am I practicing my values in a practical way? And so that's something to consider as well when it comes to martial arts, is all those values that I just mentioned. And also patience, form is a big part of martial arts, proper form, which we can also see when it comes to proper form with communication or boundaries or self-care or whatever it is. So I know that's a lot, so I'll sound off on that part.
No, no, not at all. It's fascinating. And many people don't really understand martial arts. They've got maybe two perspectives. One is, people practicing in a dojo, and the other one is kind of mixed martial arts in the UFC. And they don't realize that there is this entire philosophy. It's not just about fighting skills. It's actually about how you live. So much of it is about your mindset. And I remember I spent some time interviewing Kung Fu masters in Vietnam. It was one of my favorite assignments when I was working as a travel writer. And just hearing, even within the Kung Fu community, how there were so many different perspectives. Do we absorb the opponent's strength or use their strength against them versus the more active forms? And then there was this whole component about healing, which was really interesting, and how some of the masters ended up becoming, healing therapists, which I thought was just mind blowing. I guess it's a really holistic perspective, and this aligns with how you approach addiction recovery and trauma.
Yes, Yes, absolutely. I think that's awesome that you bring up how there's so many different styles and approaches, which shows just like with mental health and recovery from addiction, there's not one path to the garden. There's many, and it's really cool to see that these martial arts grandmasters, these teachers can become healers as well. And yeah, there's so much overlap when it comes to mental health and yeah, healing in general.
You specialize in a field called ART, Accelerated Resolution Therapy. Perhaps you could tell us a little bit more about how it works and how the effectiveness in treating patients.
Sure. So, accelerated resolution therapy, the tagline of that therapy is keep the knowledge but lose the pain. And so, what someone is experiencing is they're going to not forget the traumatic memory, which in this therapy is called scenes, a scene, like out of a movie, but it's a scene in real life. But they're going to keep the memory, but they're going to lose or significantly diminish distressing images, sensations, feelings, core beliefs, those types of things. And so we're changing negative images to positive images in the mind. And that's done through a procedure, a protocol, which we could spend the entire rest of the podcast talking about. Just even one of the scripts that's used. It's very surgical, it's procedural. If someone gets the same script more than once, they know what's going to happen. Like, it's not like I deviate from that script a lot. And yeah, so there's different scripts for different things. I have an anxiety script. There's one for pain management. There's one for kind of like depression. It's called The Little Liar. There's one for OCD, one for ADHD. So yeah, it's just a different way because it's nonverbal, it's non-invasive. The person does not have to bring up verbally what they've been through. I've been through sessions where I've only known bits and pieces of what someone has been through trauma-wise, and they are able to reprocess in a way where those visuals, those images are no longer distressing. It's like taking a bullet out of a wound that's been infected. I can pull that bullet out, allow the wound to heal. And that's what ART does in a very economical way because we work on past, sane, present triggers or present sensations and then a possible future trigger, a scenario connected to that trauma all in one session. And then it's done.
That's incredible, incredible. For those who are not aware of how trauma works, a lot of people think it's all in the mind, but it turns out that it really is emotional, and we store these emotions and they recur in our bodies. So it sounds like an important piece of this process is releasing those emotions, releasing what has been stored in the body. Perhaps you could help me clarify that in terms of what actually happens with trauma.
There is that release. It's a release of those emotions. It's a release of the triggers. It's even a release of the core beliefs that's been holding me back. It's a release of what's happening to me somatically in the body, just like Gabor Mate, which the people listening may or may have heard of, may or may not have heard of. He's quite big up here in Canada, in the Vancouver area, and he talks about, trauma does not. It's not what happens to us, it's what happens in our body in relation to what happens to us. And so accelerated resolution therapy allows someone somatically through metaphor, wordplay, different interwoven therapies. It's like CBT, cognitive behavioral therapy on steroids. Guided visualizations are involved as well. A person's able to release that energy related to the trauma. And so what happens is we can actually bring that trauma to encode it with the hippocampus, which is all about memory. We can actually store that memory in what's called declarative memory. So it's actually autobiographical now. It's not just scattered like bits and pieces throughout my brain. It's actually cohesive now. It's stored. And that way it does not impact me as much as it once did. Because when I'm getting triggered, it's the brain telling me this has not been reprocessed to a place where it's a memory that's been stored properly. And I'm doing a very dumbed down version of what's happening in the brain, obviously. And and of course, the amygdala, which is the smoke center of the brain, and smoke center of the brain, as Bessel van der Kolk calls it. And he wrote the book, The Body Keeps the Score. What this therapy does is also start to calm that amygdala. And so those triggers are not, well, they're not triggering me as much as they were. The brain recognizes there is not a present threat.
So a lot of trauma is our belief around what happened, because we can create stories and then give them meaning, and then suddenly anytime our brain detects a similar pattern, it triggers that story. So what we're doing is kind of rewriting the story and saying, well, that happened. You can't get rid of it. You can't copy and paste or delete. It's there, but it's rather just integrating it and saying, well, that was an experience and I don't need to repeat it anymore, in a nutshell.
That's a level way to say it, Brad. I am integrating this experience. It no longer hurts me. It's no longer pervasive. And so I love the word that you used, integration, because that's what we're doing. You're right. There is a cognitive piece. When I'm able to work on the somatic part through ART, but also the cognitive. So I am unsafe is maybe the core belief that corresponds to my body. I am unsafe. ART can work on cognitive and somatic. Now I am safe.
And do you encourage people to move during these sessions? Is it all just a talk therapy, or is there breathing or other types of physical movement?
They're usually sitting down, and I'm not sitting directly in front of them. I'm sitting a little bit to the side because I'm using my hand for eye movements. It is an eye movement based therapy. And there are some breathing points where I'll get them to breathe in through nose, out breath through the mouth. And if they start to have an abreaction, which means they start to be very hyper-aroused or hypo-aroused and they're starting to shut down, then I will bring in some different interventions. They usually involve guided visualization and breathing to either bring them up or bring them down from hyper-arousal.
Yeah. Let's talk about addiction, because that's a real theme in your book. And I had a look through your book. Great cover, by the way. The link is in the show notes for anyone who is interested in exploring it. The book is called The Martial Art of Recovery, Self-Mastery Practices to Subdue Addiction and Achieve Mental Wellness. And it's available on Amazon. And inside of the book, you actually kind of, and correct me if I'm wrong, but you draw parallels between martial arts and recovery, and it's fascinating. I love the way that you've done that. Perhaps you could talk us through how you use martial arts metaphorically as a way of dealing with addiction.
Sure, absolutely, I can do that. I can take a stab at it. Yeah,
let's do it. Yeah. You've written
let's jump
book.
in. Yeah, I've written the book, so I may as well jump in, right?
Yeah, let's do it.
Yeah. So one part of the metaphor is seeing addiction as the opponent.
Okay.
And when it comes to addiction recovery, and what that does is it externalizes the addiction. Just like when we work on depression or anxiety or even trauma, we want to externalize as much as possible so we don't feel like it's so internalized to where we can't do anything about the concern. When we look at addiction as the opponent, we can start to see all its idiosyncrasies, all its different tricks, its behaviors, its inclinations. Just like with martial arts, I have to know my environment spatially. I have to know what's happening in my environment. I have to know, is someone going to saunter around the corner? I have to be ready for that. Just like with addiction recovery, I have to be prepared. I have to be accepting of that preparation, accepting that I need to be willing to be ready. And so there's that part around it being an opponent. And just like an opponent, I think you were mentioning earlier about, do I use the opponent's body weight, against them? Well, that's one thing that the addiction would like to do with us, is use our core beliefs and our different, our different, I guess you could say, flaws or weak points, within ourselves, and wants to use those to draw us in. and then strike. And if we know those and we know the opponent, we have a better chance of surviving.
And part of the journey is learning the techniques to enable you to be more agile and effective in those moments. Because if I'm correct, addiction is usually for life. It's just how you deal with that opponent.
Exactly. I heard once, and people take it different ways, but a pickle can become a cucumber, but a cucumber can't go back to being a pickle, or maybe it's the other way around. Cucumber can become a pickle, but a pickle can't go back to being a cucumber. There we go. And so, usually addiction is chronic, progressive, primary, which primary means that nothing exactly causes addiction. There's just a lot of different predisposition type factors. There's not usually just one thing.
How do people know if they have an addiction? In your experience, do they have to hit rock bottom and then someone forces them or pushes them to come and see someone like you? Or can some people kind of just manage it themselves and, gradually find a path of balance that kind of works?
I've worked with folks, Brad, that they were in their, X amount of treatment stays in an inpatient treatment facility for addiction and mental health. But I've also worked with people that have come in, they recognize there's a problem, they did not hit rock bottom, and they got the help they needed. And so there can be a balance that they can find as they go through their journey on what they need to do for themselves. And I don't feel like people have to hit rock bottom for themselves. I mean, some people do have to go through some consequences, but I don't feel like that's true for everybody. I believe it's up to the individual person and where their resiliency level is and where are they at on the stages of change. Are they in that preparation stage? Maybe they're pre-contemplative, and yes, it's going to take a few times. So it's really dependent on the individual, and balance can be found through dedication and perseverance.
That's a good quote. When does a vice become an addiction? Is it when the person no longer has control over it?
Yeah, that's a really good question. I'll borrow from, I guess you could call it cheat. I will borrow/cheat and do the American Society of Addiction Medicine, or CSAM. It's equivalent here in Canada. They have 5 different criteria for when it becomes a concern for people. It's the A, B, C, D, and E of addiction. I'll just give them really quick. So the A is the inability to abstain despite negative consequences. The B is impairment in behavioral control, hence the B. The C is craving. The D is diminished recognition of problems in my relationship with others and also myself. And the E is what's called a dysfunctional emotional response, which means I make mountains out of molehills and molehills out of mountains. I get lost in the shame. And so those are if someone's meeting, if you're seeing a little bit of each, or there's a few of those that are really predominant, then perhaps I need to take a look at this.
You mentioned resiliency, and I have a strong interest in that field, being a partner at Resilience Institute Global. I'd love to hear your thoughts on resilience, and is it something that you can build? Is it something that you have to endure life's challenges in order to acquire it, or maybe a bit of both?
I feel like it's a bit of both. Yeah, I feel like I don't have to jump into either boat there. I can put legs in 2 of the boats.
I agree.
Yeah, and I think one of the pieces with resilience that's important for everybody is what's called perceptual maturation, which is just a very jargon way of saying maturing my perception about the events that come to me. I think it was Wayne Dwyer that said, change the things you look at and the things you look at will change. And so I think that it's important for us to look at a perceived threat, or is this an actual threat? So yeah, resiliency it's huge. And I mean, there's so many different facets. I know that that's your wheelhouse, and there's so many different spaces we could go into there.
Well, I must admit, I've never heard of perceptual maturation. I'm learning lots today. I appreciate this, Eric.
Yeah, no problem. No problem, Brad.
So can we be deliberate or conscious about developing that maturation, or Is it a journey of building that self-awareness first, and then the kind of metacognition, I'm aware of my thinking, and then being able to upgrade it in some way?
Yeah, I think that the metacognition, the self-monitoring and self-talk, or thinking about how I think, is very important with that, and that can be cultivated. It needs to be cultivated. It needs to be cultivated proactively, which is a big part when it comes to resiliency in any form or fashion. So, one thing to look at with perceptual maturation is internal versus external locus of control. An external locus of control means that I leave my life up to fate, luck, chance, just, possibilities outside of my control. Whereas if I can look at internal locus of control, then I can see that I have some skills, I have some aptitude, I have some experiences I've been through. And if I can have that mindset, then I can persevere through this.
Yes. That locus of control is so important, and people get caught up in playing victim. And I say that with compassion for people who really are victims of circumstance. Terrible things happen in the world, 100%. But I've seen people who adopt that mindset of the world is out to get me. And I often look at it from two perspectives. Am I a victim of my circumstances, or am I creating my circumstances? Am I actually, engaging with the world? And the only way to do that is by focusing on what's within your locus of control. You can't really start making an impact before you take action, even the smallest things. Any thoughts or tips for people who find themselves in those situations?
Yes, and that's a really good point you bring up, Brad, as far as the victim. I can be a victim, as you said, and people do go through things. However, playing a victim is something entirely different. And there is something called the Karpman drama triangle, which folks may or may not have heard of. But the Karpman drama triangle, which comes from, drama, like acting. And so the three parts on that, the unhealthy parts are victim, persecutor, rescuer. What we're trying to do is switch over from a victim to a survivor or a thriver, from a persecutor to a protector, and from a rescuer to a helper, where I don't rescue at my own expense, mentally, socially, emotionally, spiritually. And so that's all well and good. Like, okay, that's great, Eric. Great information in the Karpman drama triangle, but how do we deal with that? Two pieces: boundaries and healthy communication. And I guess we can even throw in resiliency as well. And so if I haven't thought about that until just now, as far as resiliency being a part of switching over to those. So I think that's important too, is okay, I might play the victim, yet I also may play another one of these parts a lot. And if you're like me, and just to throw myself out there for a moment, I've played the victim for sure. And I've probably done the rescuer as well, and I tend to go between those two. Since I'm pretty laid back, I don't usually become the persecutor. So I have had to learn, okay, do I need to take more responsibility? Do I need to take more proactiveness here and get out of this victim piece, woe is me, and actually start putting in boundaries, be proactive, resilient, healthy communication, all that. So that's a piece I would give to anyone that's listening with that.
Very, very nice. Yeah. I tend towards, and I saw it definitely when I was younger, was alternating between the victim. Oh, this is all so overwhelming. Everyone's out to get me. I'll never get a chance to do the things that I want to do. And then rescuing others, because it feels quite good. It gives you a sense of purpose. But ultimately, you end up in that empathic distress where you're just giving and giving and giving and blaming. It's not a good place to be. Nothing good comes out of being there. So I like what you said about boundaries. I think that's super important. Potentially, any tips for someone who's a real people pleaser and they struggle saying no?
Yes, and I've been in that crowd. Absolutely, yes. Yeah. I mean, I did hear. Everyone knows about the FOMO acronym, fear of missing out, and that's definitely alluding to addiction. But there's also this one I recently stumbled upon listening to another podcast, was FOPO, the fear of people's opinions. And I do feel that for a lot of us that have that struggle, it's being able to give ourselves some self-compassion, yet also being able to be assertive with what we need. Maybe not necessarily what we want, but what we need for ourselves. And that comes through that, again, self-compassion, but also being gentle with ourselves and starting to feel it out, doing it maybe at a small pace, doing it with the small things at first, and then starting to do it more frequent, and then with maybe larger requests of people. You can still do a large request, yet if you feel like it's like super overwhelming to start out doing it all the time, I'm going to do it a little bit, see how it goes, start to cultivate, just like with resiliency, it's cultivated. Small hinges open large doors. So I'm going to be cultivating this step by step and just be gentle with the process.
Make it a habit, small steps in the right direction rather than grand sweeping resolutions. I read somewhere that 80% of resolutions fail by the 1st of February. So it's kind of like that doesn't work. Although you may get a little bit of a dopamine hit when you think about how it's going to feel after I am, running that marathon, or I'm a different version of myself. But the reality is it has to happen in small steps most of the time, I would say. Any thoughts on habit formation?
When I was in New Zealand, one of the friends that I was able to make, he was originally from Texas as a rancher, and we were helping him basically direct some cattle on his land. And it started to get dark, and I didn't want to be out there really any longer. It's getting a little eerie because we didn't really have a lot of flashlights, and it was really one step in front of the other, and sometimes I did not know exactly where we were going. So when it comes to that habit formation, a big part of that is faith. Faith in the process, faith in myself, faith in how I can actually maybe help, get support from others. And so with the faith comes also the action. Those two have to be together. And so I think a big part of that is having a daily awareness when it comes to habits, which can be 3 questions. What am I doing? What's this leading to? And a third one, which is escaping me. But yeah, what am I doing? What's this going to lead to? And the third one is something on the lines of, what am I going to get out of this? Like, what's going to be the main piece I'm going to get out of this, which is similar to the second one. So at least those first 2. So we could even do, it's called implementation intentions with habits. If I do this, then I'll get this. If X, then Y. So if I don't eat the chocolate candy bar before exercising, I'm going to have an easier time exercising. And so that's a very rudimentary example, but I'm seeing the consequences of not going toward and what I actually gain from not going towards something.
Yeah. Another area that you specialize in is grief. And we all have experienced grief in our life, and it's undoubtedly something that as humans we will all experience at some time. Any thoughts on interventions or tools to help people deal with grief or overcome grief?
Absolutely, Brad. I once heard a quote during my training for grief. It was a 16-hour or so training for that, and the lady that had been doing a lot of the training said, "Joy shared is joy doubled, and grief shared is grief halved." And a big part, I think, with grief for us is having that support around us, which is also true for resiliency as well. Having that tribe, having those supports, having those people in my boardroom that I can depend on, and a few interventions for grief. So from what I was taught anyway, grief counseling is for quote unquote the normal grief process, if you want to call it normal, just the organic process. Grief therapy is when it becomes complicated grief, where I still have some symptoms and signs of grief that usually abate around the first year, like the yearning and longing is still as pervasive as it maybe initially was, and it's starting to maybe impact my life occupationally, socially, all that. So that there's a difference between like grief counseling, just walking with someone, and then grief therapy, which is a lot more it's a lot more about the intensity of grief when it's not abated in an organic way as we go through. I mean, grief never really goes away. It ebbs and flows. It's not like, there's a stopping point for grief, but there can be a time when it might hurt me or others if there's symptoms. So as far as grief is concerned, it's really being gentle with ourselves. One of the interventions is called a memory box. And so I'll give you the example that was given to me is a memory box for someone that had an abortion that they were coerced to have. They will put in maybe a book they wanted to read to that child that they initially wanted to have, but then were coerced to abort. So that's an example. So a memory box could have, linking objects for the person that's deceased, or could be letters or pictures or clothing, whatever it is. I can take that out 6 weeks later, 2 weeks later, yearly, whenever I want, but it's there for me regarding the person. Another intervention is photo narratives. So I'm able to take pictures of things in the environment that remind me of the loss. I go out to the woods, I see a tree that fell, I realize, hey, that tree was meant to fall then. This person, unfortunately, was meant to pass on now, but I get that now. It's a way of life. And so, not taking pictures of people because that can be creepy, but yeah. So there's photo narratives, but there's also, there's scrapbooks, there's photo albums, there's also music, which is really important for boosting dopamine, but I can maybe create a playlist that reminds me of that person, and I can play that. I can play those songs when I'd like. Journaling as well is a big one, perhaps 4 times a week, but not every day consecutively, maybe a Monday, Wednesday, Friday, that kind of thing. And maybe 20 minutes, if you can, journaling about the process. Maybe you burn those pages later on. Maybe you write a letter to the person that you've lost and then you burn it later. You keep it. Maybe you write a letter to yourself of you at that point that the loss happened, if it was a while ago or even recently. And so there's a few of the examples that people can use when it comes to just furthering along with the grief process, and also rituals. Rituals are important too, and that's a whole nother topic, but it's definitely good. Even for things where people don't die, like divorces can have rituals too.
Well, that's true. Yeah, you forget about grief when the person is still around, but a divorce or a breakup or even your children leaving home. I'm not at that point yet, but it's going to happen at some point, and there will be. I feel it already. Preemptive grief, even just thinking about it. So, which encourages me to be more present now, because I know that that's the best thing I can do in the moment is just enjoy this experience. But it seems like all of the tools that you've recommended, the interventions, actually require a little bit of reflection. It's not about, parking that thought for later. It's actually about dealing with it now.
Yes, there is a proactive element.
Why would you journal every second day, just out of interest?
It was told to me just for the person to not get overwhelmed and then allow them to process the day after what they wrote the day before. And so it gives that extra day to, just kind of go through what was already written down before. Yeah.
How important is curiosity in supporting mental health?
It's super important. And even on the context of grief, if you want to go into that for mental health, it's being curious about my thoughts, my feelings, even my yearnings, my longings that I had for that person. It's not pathological. And I want to say that for people. It's not pathological to get curious about how you want to keep correspondence with the person that you've lost. That is not pathological whatsoever. I mean, now, sure, if it's 20 years down the line and there's that yearning to be in the grave with them, then okay, that's something that might need to be talked about if it's impacting my life in different areas. But when it comes to curiosity, I can even take it back to addiction. There's a martial arts technique called courting the tiger. And now courting the tiger, if we translate that technique over to addiction recovery, is courting the curiosity. And we can use that for mental health or for addiction recovery. I get curious about my beliefs and I get curious about my values, and I get curious about my boundaries and self-help, and being able to look at ways to do the self-care for myself. There's not really a place for seriousness when it comes to curiosity, because I'm serious and I know everything and I can't look at that. It kind of gives that type of mindset. And so, I mean, yeah, sure, there's a time to be serious at certain events, but when it comes to life, transformation, resiliency, exploration, curiosity is something that opens the doors for me where maybe I didn't think they could be opened. And it's so important for depression, because depression likes to close the door on any type of alternative. And just getting a little bit curious about what it might be like to take a short walk through the neighborhood, and maybe a neighbor comes and greets me that I haven't seen in a while, and I strike up a conversation, and I'm not as isolated.
Curiosity is very powerful. In fact, that's one of my top 3 core values. And I find that in those times, I never thought of it, but in times of real challenge and distress, it wasn't there. I remember there was a period in my late 20s, early 30s, when I was feeling depressed, and it's so true. My writing stopped. My creativity stopped. It just wasn't there anymore. So any tips for someone who wants to reactivate that curiosity? Is it really just, for me, it was changing location, because as soon as I was out of my regular routine and location, suddenly the world opened up. I was like, whoa, look at all this stuff. You're kind of curiosity by design, because you're somewhere different. I don't know if you have any other thoughts around that.
Oh, I think that's great, Brad. I believe that spontaneity breeds curiosity. So if I can be spontaneous and get out of my environment and try something at least a little different, and then that can open up so many possibilities. Yeah. So I think that's a really good point that, yeah, I'm going to go visit this person, or I'm going to go to this park that's different, or take a drive, whatever it is. And it's like, okay, I get out of the funk of the isolated surroundings that I'm at.
Any thoughts about dealing with fear, whether it's fear of rejection, fear of being alone, fear of doing that important thing? Because I'm sure that through your martial arts training, being able to deal with fear is essential.
Yes. And there was times during martial arts where there was a lot of fear. I had to fight my sensei for my black belt without any gear, and he's like a 6'2", and I talk about this in the book. I mean, he's a 6'2" or so ex-Marine, if there is such a thing, and I mean, obviously he held back, or I would have ended up unconscious, but at least that's what I tell myself. So yeah, how do we overcome fear, or false evidence appearing real, as an acronym? There's also 2 more acronyms: face everything and recover, or flee everything and, not recover. I guess flee everything and run, FEAR.
Yes.
So really a big part of that is, do I want to feed fear, or do I want to feed faith? And I don't mean religiously, although that can be a part of it for people. For me, it has been in the past, and we can bring spirituality into this when it comes to fear. What gives me spark? What gives me purpose? What gives me meaning? If I'm able to tap into those parts, can they help me with the fear? Can what gives me purpose and meaning help me with what I'm going through with fear? Because they give me spark. They give me drive. Could they potentially help? Just something I'm jostling as we talk on the podcast right now. I'm not really sure myself exactly. So with fear, it's really just taking that one step at a time. And I did martial arts tournaments when I was doing the Waddle Roo when I was a preteen, and I did not like doing those. Those were just, as an introvert, those were a pain. I was a closet extrovert at the time, and just had to go through it. I had to move through it, and I believe perfectionism has to be worked on in order for fear to not entirely grab us. Otherwise, if we fear about being perfect, that fear will constantly be fed. Goes back to that self-compassion and goes back to demoting ourselves to being human and just giving us a chance to breathe.
That's an interesting. I thought what you said before was quite beautiful. It'll be a great takeaway quote from this episode about reconnecting with your purpose. And I suppose that's the theme of my forthcoming book, Start with Values, is if you know what you value and you're really clear about it, you can step into the unknown. And I think I say in the book, with confidence, and confidence is trust in yourself. And that comes from knowing what you value. So I think we're coming at it from very similar angles there, which is great to hear.
We're converging.
We are converging. What's it like to be in a martial arts tournament and suddenly you're thrown into the thick of it? You've got to fight someone.
Well, if you've ever seen Bloodsport or, it's nothing that extreme because we do have gear on.
Yeah.
However, it can be very competitive and all eyes are on me because I could be doing a kata, which is like a kind of like a dance routine, but for martial arts. It's choreographed, it's memorized, rote memory, and that can be very daunting. And just sparring other people my age, it's anxiety provoking for me, or at least it was. It's very uncomfortable. It's exciting in a certain way too. It's mostly anxiety producing, but other people probably had different experiences.
Yeah. It's really cool to see. And I'm interested in your perspective on this, but people, thought of karate as it's not as effective as kickboxing, or it's not as effective as some of the other martial arts. But it turns out it is. When you see someone like Stephen Wonderboy Thompson, who's a UFC fighter, he is karate through and through. And it is by far one of the most effective styles in real combat situations.
Yeah. Yeah. It's amazing the practical application that can be done.
Yeah, absolutely. Mm-hmm. Do you change when you're in that combat situation? Because you seem like such a lovely, calm, empathetic person. Do you find that a different version of yourself emerges?
Yeah, when I was practicing, yes, it was like I had to put on a different persona, one that's a lot more like assertive in a physical sense. So yeah, it is a different side of me. I think there's a part of me that's still, the way I usually am authentically, but there is a side that's there when I'm, just like a baseball player or someone else. Yeah.
How was the process of writing your book? Did you enjoy that whole process? What inspired the book?
Well, I wanted to be able to give folks a different layout of different treatment techniques when it comes to addiction and mental health. And then I started to meditate, started to contemplate what could be a intersection. And I thought of martial arts, which is, it's been a big part of my life, still is. And so I started to look at the possibilities, and I came across this manual, several manuals, in fact, by Eric and Kevin Lampkin. A shout out to them, because without their material, I would not have been able, without their permission with the material, I would not have been able to do the book out of Kentucky. And so when I started to see that there was some great metaphorical messages with the visuals that could be done between different belt techniques, and also between different concepts, because there's over 90 different martial arts terms or concepts in the book translated over to recovery. So I just started to research, and I started to wonder, and I started to get curious again. And the book came to be what it is.
Amazing. And people who have never written a book won't understand that in between the inspiration and the research, there is a lot of painful sitting down and trying to craft words into sentences and sentences into paragraphs and so forth. It's not fun. I mean, so many people I meet go, "Oh, I want to write a book." Great.
Great. Yeah. Go for the gold, man. And then, yes, I hear you, Brad. It can be a very isolating experience. Yeah.
Yeah, exactly.
Yeah.
And the self-criticism flares up and goes, what is this? This is all just nonsense. Why am I even doing this? But ultimately,
Oh yeah.
it's like building a house or anything.
Brick by brick, frame by frame. Got to break the doubt, and I definitely had to break the doubt over and over.
Yes, yes. Thank you so much for such an interesting conversation. I've really appreciated it. How can people connect with you? What would you like them to do?
I'll try to make it brief. So recovery arts counseling, and that's going to be the word usage on Instagram for the website. So that.com. Counseling with 2 L's up here in Canada. It may be the same in New Zealand. I'm not sure.
It is, yes.
It is, okay. And also, it's the same with Facebook and also LinkedIn as well. And you can find me, Eric Fisher, on LinkedIn. Yeah.
Excellent. And all of those links will be in the show notes. So everyone who's listening or watching, please do go and explore and connect with Eric and the work he does. Any final thoughts for those who stuck with us all the way until now?
Thank you all for listening, and with whatever you're persevering with, whatever you're going through, whatever you're hoping to achieve, I wish you all the best, and I would say keep on keeping on. And as was said earlier, you have so much empowerment that's waiting to be bestowed upon you. Keep the faith and action going within yourself. That's all I got there.
Thank you so much. What a fantastic conversation. This is what feeds my curiosity, so I really appreciate you. And thank you all for tuning in to another episode. We'll keep them coming.